Thanks everybody for joining. This is the Society of Thoracic Surgeons Adult Cardiac User Group call for March 15th, 2023. On the line with me from STS, we have Addie Dolan, Melinda Offer, Sydney Clinton, and Leanne Jones. Just a few updates, and then we're going to do our data manager poll. So have your polling fingers ready because we have a lot of questions. I got to have a lot of questions for you all. And then just Q&A if you have any questions. But today really is just going to be focused on the data manager survey. March training manual is posted. Harvest 1 2023 report. Its pre-analysis cleanup was complete. It just went into analysis late last night after doing some cleanup. I did have to reach out to a few sites, and we'll talk more about that on an upcoming webinar, but not today. The results are expected probably the end of April, I'm thinking, for to be published in the IQVIA platform for you all. Today is the March 15th data manager survey. If we have time, I'll do the procedure identification chart. I'm not sure if we'll have time or not. If not, we can move it to one of these other calls. The monthly webinar for April is April 5th. User group call is April 19th. If we do not have the Harvest 1 report back yet on April 19th, this is where we'll do the PROC ID chart. Harvest close, we'll prepare for that on May 3rd. The harvest closes on May 19th. I'll be reaching out to sites the 2 weeks prior, probably May 7th through the 8th. If we see that you're at risk for being excluded due to 2% missingness on the mortality variables, mortality discharge variables, and the 5% missingness on the NQF variables, I'll reach out to you and we can talk more about that in the May 3rd webinar. And I think that's all I have for that. Go ahead and if you have any questions, submit them into the Q&A box. I'm going to shut down the chat box right now. Please get your polling fingers ready. Some of these questions will have multiple questions that you need to answer in order to close the poll. So just make sure you scroll through. And it'll say multiple choice where you see, make Melinda co-host here, and Leanne Jones. You'll see multiple choice where it's you're able to select more than one answer. So please make sure you select all that apply where you're able to, if it makes sense for you. Okay. First set of questions is tell me about your database. So this question is which database do you abstract for? Make sure you select all that apply. And these results will be published. Sites have used these to determine if they, to help support adding abstractors onto their sites or look at your case, your time for abstraction or your volume or things like that. So the options for this question are ACSD, GTSD, CHSD, Intermax, PDMax, or you don't abstract. And I tried to add NA into these for folks who are just on the calls listening to get education and who aren't actually abstractors. So go ahead and I'll let this run just for a few more minutes. I'd love to have everybody get their answers in if possible. Or not minutes, a few more seconds. I guess we'll let it run for a minute and see where we go. Okay, I'm going to end the poll now. And there's your answer. So 90% abstract first. We can't see the combination. I'll put these out on slides or we combine them so you can see if more than one more where folks are abstracting on these calls, what database they belong to. Next set of questions is what is your background? So this is the first question is what is your background? We have nurse, APN, perfusionist. We'll put PAs with the advanced practice nurses, perfusionist, QI non-medical, IT non-medical, HIM or medical records, other clinical, cardiac physician or other physician or NA. And then how long have you been abstracting? What work, who do you work for? Hospital, data abstraction company, or both? No, I'd like everybody who's on the call to answer. Erica's asking if they have multiple people on the call right now. Oh, if you're all sitting in the room together, just one person answering is fine. We've had a sudden staffing change Beth, please feel free to reach out to me and I'll put you in contact with support. They can help you do that. My email is ckrohn, CKROHN @sts.org. And I'm going to end this poll. Did everybody get their answers in? Yeah, RTR, I would put that in other clinical, please, Rebecca. Thanks, Leanne, for putting my email there. I know that our hospital, the one hospital I worked, we did have angiotex abstracting as well. I would put that in other clinical. Okay, I'm gonna go ahead and end this. We have good response right here. A lot of experience on these calls. Here are the results. So most folks are nurses, 76% are nurses. And then it looks like other clinical, which is probably the RTs, angiotex, cath lab techs, and things like that. Most folks on the call have been abstracting for 10 years or more, lots of experience and within this group. And then we have 11% who are less than a year. Oh, can you see my results? Okay, sorry about that. Less than 11% less than a year, 28% 10 or more years. Really great there. Almost 90% work for a hospital, 7% for data abstraction companies, 4% for both. We'll go to the next set of questions, which is focused on data abstraction. First question is, what is your role regarding data abstraction at your site? This is first question is a multiple choice. Are you primary backup or physician representative? And do you abstract or do you not abstract? Or other. If you're not listed as any one of those roles, just click other. How many cases per month do you abstract? Can you all see my questions? Leanne Jones?
Yeah, I'm sorry. I can see it, but that doesn't look like anyone's responding. I don't know if there's,
Okay.
I don't want to, I might need to launch it again.
I'm going to end poll and relaunch it. Let's see. How about now? Can you all see the questions?
I can see it, but it's not responding.
Can you all respond to them? I see the thumbs up.
I
It's
see the
not
thumbs up.
updating on my side. Okay, well, I'm just gonna hope it's going.
It says they're answering. Tell people to scroll down. There are 10 questions.
Oh, maybe it's not gonna fill
There you
my
go.
thing in until all the questions are answered. That's probably
There
what
you
it
go.
is.
Yeah.
Okay, so there's 10 questions, quite a few questions on this one. First question is, what is your role regarding data abstraction at your site? Primary or backup data contact, physician representative, and then do you or do you not abstract? That's all part of one question. Second question is, how many cases per month? Now the answers are coming in.
Yeah, they're like, give us a minute.
Time.
It takes a while to answer.
Yeah, I guess I forgot there was 10 questions to this one.
Yeah.
Average time spent abstracting a case, less than an hour, 1 to 2 hours, 2 to 3 hours, 3 to 4 hours, 4 hours or more. Do you abstract in real time within 1 week of the OR date, 1 to 4 weeks after OR date, or greater than 4 weeks after OR date? Does your hospital use a third-party abstraction company? What sources do you collect data from for extraction? Are you using EHR solely? This is a multiple choice. So if you're using both, please select both EHR and or paper scanned medical records. How do you abstract data? Are you abstracting on the paper data collection forms and then entering into vendor software or direct data entry? Or are you abstracting directly from your computer screen into the vendor software or direct data entry? Do you have a process in place for tracking patients post-operatively / discharge? Yes, you have a patient process in place, or no, you just hope for the best? Do your surgeons fill out the operative section or utilize the surgeon worksheets? Yes, they fill out the operative section. Yes, they fill out the surgeon worksheets. Yes, they fill out both, or no, they do not fill out either. the operative sheet or the surgeon worksheet. Is your surgeon available to answer questions? And I'm going to let this run just for a little bit. I know this is a long poll with lots of questions. Folks are still completing all of them. So go ahead. Let's see if I can answer any of the. Yeah, I would answer how many cases they abstract for you if you have a vendor abstracting for you. Yeah, I would say for the, and then Ala is asking for the timing question, we abstract after discharge. So I would say 1 to 4 weeks after OR date is probably what you're abstracting in. I would just do your best with answering the questions. They don't have to be perfect. We're just trying to get a good picture of what your lives look like as an abstractor. Some of them are all that apply. Some of them are just single choices. So
Kara, did you see the question from Rebecca?
let me see. Yeah, average caseload is fine, Rebecca. Per facility, or how many cases? No, do you abstract per month? I would just average what you abstract per month as one person. And then we have a question, I think, about how many cases per year does your hospital perform? I don't know that it's in this question. It'll come up though, I think later on. So. Okay, I'm gonna end the poll here. We got good response, right? And here are the results. 62% are primary data contacts on this call, 24 are backup, 1 physician representative, 58 abstract, 14 do not, 5% other. Most on this call are abstracting somewhere between 20 to 50 cases a month. Average time spent abstracting is 1 to 2 hours. Most folks right now are abstracting 1 to 4 weeks after OR date. We do have 10% of people abstracting real time. So thank you. Thanks for doing that. We'll have to compare these results from last year and see if that's changed at all. Currently, 73% of folks on this call are not using a third-party abstraction company. And almost everybody uses their EHR. 40% are using scanned medical records. 30% are abstracting onto paper and then entering into vendor software. About 70% are doing it directly into the vendor software. Just about everybody has a process in place for 30-day follow-up. Most surgeons are not filling out the operative sheet or surgeon worksheets, but they are available to answer questions, which is good. Hopefully, all of them are available to answer questions, but I see 11% are not, which is something we'll have to work with our surgeons on. Okay, I'm going to go to the next set of questions, which is show me the numbers. 2 questions here. How many cases per year does your hospital perform? So what's your yearly volume of cases? And how many people abstract at your hospital? And there you go. I'll let y'all answer this and I'll go to some questions here. Danette, our perfusionists fill out the STS forms for the surgeons during the procedure. Nobody signs it that I've seen. Where did my question go? I would put in average volume for the hospitals that you work at. If you're working at multiple hospitals, or you could pick the largest volume hospital. Just answer the question specific to that, to your one site if possible. All cardiac cases that you're abstracting. Oh yeah, I screwed that up. It's supposed to be 50 to 99. It was screwed up last year too. or in 2020 when we did this. It should be 50 to 99, where it says 50 to 11. No, all procedures that you're abstracting into the database. Yeah, number of abstractors. So some sites have abstractors who work on multiple databases. They might be STS, NCDR, whatever else you have, whatever other databases there are, CMS core measures or anything like that. I would just put the number of, I guess FTEs would be a good way to look at it, or number of people focused on STS, even if they're not full-time. This is where we usually fall about 2 to 4 for that answer. STS cases. I don't think you can, Philip, but go ahead and put something in the chat box. I'll open it. Or I'm sorry, put something in the Q&A box regarding your submission to change your answer if you want, so I can note it. Abstract for STS. Should be 1,000 to 1,400. Greater than 1,000. Oh, that's fine. Okay, thank you, Philip. Got it. Okay. I'm gonna unpoll here. We had good participation. And there are your results. Most on this call. 35% of people on this call are averaging between 200 and 500 cases annually, with 100 to 200 and 500 to 1,000 cases, both right up against it. Just a nice curve. And then most sites have 2 to 4. Last time we did this, I was able to show you the number of, when you answer these questions together, I'm able to show the number of abstractors per case. So Philip, I'll make sure I update yours before I make that slide. That helps with determining FTEs at a hospital if you choose to use that information. All right, experience. Let's see what we got. One question. What's your previous experience? Are you clinical, non-cardiac surgery, clinical cardiac surgery, non-clinical but within healthcare, non-clinical and not in healthcare, or NA? Yeah, that's fine, Ala, for answering for all three. That's fine, Amy, you answered fine. I'm not sure what ECB abstractors are. Melinda, do you know what that means? How do ECB abstractors factor into the number of abstractors?
Not sure what ECB is.
Okay. Looks like we got good answer on this previous experience one. I'll run for just a few more seconds here. Oh, I would answer clinical non-cardiac surgery for that one. For that question, if you're RTR. Okay, I'm gonna end this. I hope you got your answers in. Pretty close. We have 41% clinical non-cardiac surgery experience and 48% clinical cardiac surgery and 10% non-clinical, but within healthcare. Oopsie. All right, and then we're going to go to the next question, which is your responsibilities and duties. What are your work responsibilities? So are you STS, ACSD database only, STS and other cardiology databases like the TVT, LAAO, STS and other surgical databases like SVS? Or no, I guess not SVS, that would be another cardiology, but any other surgical database. STS database and other clinical responsibilities. Are you still working up on the floor, doing any other things clinically? Or other non-clinical responsibilities? And other, I do not abstract. Let that run. This is just one question. I'll fix it, Christy. Thanks for letting me know. Oh, 2 people emergency call back. I would just do what you do for full time and average what they do yearly. If they're only working if they're only working half FTE, I would just consider them half-time. Jackie, okay, we're gonna end the poll here. We get lots of response. We used to do these polls through SurveyMonkey and send out an email to all of our data managers, and we maybe had a 30% response rate if we were lucky on good years. Maybe we'd be lucky if we would even get 100 people to respond to the emails we sent out. So we have a nice response, which is good representation of our data managers and people who work with the database. Okay, next set of questions is going to be focused on education, STS education. There's 8 questions here. First one is, do you participate in the STS mentorship program? Aware, not participating, yes, participating. As a mentor, yes, as a mentee, or you're unaware, or NA. Do you find the twice monthly webinars helpful? Yes. The amount is perfect. Yes. You'd like more frequent calls. Yes. Too many calls. No, they aren't useful. Or this is my first webinar. I just found out about them. Number 3 is, do you feel that you have the knowledge to do your job correctly? Yes, I'm good. Yes, but I'm still learning. Or no, I definitely need more training. Number 4, are you participating in a regional group? Yes, participating. No, I'm aware, but not currently participating. What are regional groups? Have you participated in AQO in the past? Yes, annually, frequently, a few times, once, no, or what's AQO? Are you familiar with IQVIA Resource Library? Is number 6. Number 7 is, do you review the notifications on the IQVIA platform? Number 8 is, have you utilized the IQVIA resource document on the STS website? We're going to get more into the AQO questions coming up here shortly. So I'll let this run for a little bit, quite a few questions to answer. So the residency program, we can certainly ask that, Julia. We know that at STS when we are determining like groups, we check that yearly to update residency program status within the database. What if you do other cardiology and other surgical? I would just pick, I don't know if that was related to the database. I would pick other cardiology is fine. Or whatever you answered is fine, Brooke. Don't worry about it. Okay. No, Karen, I'm sorry you were not able to join on time, and we are not able to go back and re-answer the questions. These are all they're all tabulated together with everybody else's answer. I'll update it, Christy. No problem. Don't worry. Thank you for letting me know. And Karen, if you want to reach out to me at ccrone@sts.org, I can check on your mentorship status program for you. Michelle lost her mentees. I'm sorry, Michelle. Okay, we'll talk more about the mentorship program in an upcoming webinar. I just want to get through these questions as fast as we can. Okay, I'm going to end the poll here. Here are the results. 62% are aware but not participating. Mentorship program is a program that seasoned data managers, those with most experience, can sign up to get connected with the data manager who's newer or who maybe has been around but maybe needs a little bit more help. They reach out to STS to say, hey, I need some help, and then we try to put them in contact with a mentor. Most think that the twice monthly webinars are good. 56% are good, but still learning. I feel they know how to do their job, but still learning, which is good. We're all still learning. Are you participating in a regional group? Yes. Mix between yes and no. And what are regional groups? We'll talk more about that. Have you participated in AQO? Very scattered results. Yes, annually, frequently. Few folks don't know what AQO is. We'll talk about that. we got lots of things to talk about. Some people don't know what the resource library is in IQVIA, so something we can add on to another webinar. And I think that's pretty much it. Stop sharing those results and go to the next one, which is going to be database feedback. We have 4 questions here. First one is what would be the most helpful area to educate on for STS and IQVIA? And this is multiple choice. Hopefully the multiple choice is working. And then please rate STS's communication over the last year. How have you felt we did over 2022? What areas can we improve upon at STS? And how often are you using the ACSD training manual? Those are the 4 questions. I'll let you go ahead and answer those. Rebecca, if you please reach out to me at ccrone@sts.org. I'll put you in contact with the STS staff over the mentorship program to see. I know that we had a really hard time getting folks to sign up to be mentors. Quite a few mentees, but not enough mentors. So we were overwhelming some of our mentees. But perhaps things have opened up a little bit if you could just reach out to me. Same thing, Erica, please reach out to me, ckrohn@sts.org. Maria, same thing. Please reach out to me. We can check on the status of that. Karen, I'm sorry. I think I already answered. We can't go back and redo the questions. I apologize. I am the only abstractor at my hospital, have other abstractors for others registries. That's fine as long as you're answering for your hospital. You can count yourself as that. Thanks, Mark, for letting me know. I would count all of those as other cardiac, cath PCI, stroke, STS, and STEMI. I would count those as other cardiology, but whatever you put, I'm sure it's fine. We have a pretty big N with this. I think we have usually are getting about 380 plus responses for these questions. So we should be good. I have been a mentor and I have said on multiple occasions I could do more. Haven't had one in years now, stopped reaching out. Donna, do you mind reaching out to me and I'd be happy to work on getting you put together with somebody who needs help. It's not an option, but I know this comes up a lot. A better way to see all the items that have a requirement for harvest in IQVIA. So I would say for that, probably the harvest summary report or the non-analyzed participant dashboard would be a good answer for that one. Yeah, for STS, well, for the NCDR, this question was related to the AQO question that Sherry's asking. She's saying AQO is expensive, NCDR is free of charge, except for the hotel and travel. That's not really true. NCDR doesn't charge a cost for the meeting itself, but it is included in your participation fees for the data for the registry. So it's all included in the fees that your hospital's already paying if you send somebody or don't send somebody. For STS, it's a separate kind. We don't bundle it together with the registry fees, but it is something that STS is looking at. How NCDR does it, we just haven't been able to make that change yet because the registry fees are different for each of our databases. So it's a little bit different in how we would have to do it for all 4 of our databases. But yeah, I hear you, sure, you've heard that before too. Okay, I'm gonna end this poll, and I'll save all these comments so I can review them and then see if there's anything I can add to this list. That seems to be a common theme. For right now, though, from the choices that we've had, it looks like, these uploaded the data quality, critical summary, missing variable, harvest summary, reports. These are all things that we use to clean up the data. So this is all in the non-part analyzed participant dashboard. These are pre-harvest reports that we use. So we can certainly talk more about that. And we will be, I think, the first webinar in May, the monthly webinar in May, we'll be going over these in more detail. The risk adjusted benchmark report I think we can always keep learning from this. It's a very, it's an analytical report. We need to understand how risk adjustment works so we can explain these reports to our surgeons and administrators and understand what we're explaining to them regarding the outcomes and what the outcomes mean. So we'll be reviewing all of these. Folks have been essentially average or felt that the communication from STS has been good. I'm happy to hear that. And then STS database can improve on, we can keep providing more clinical education, analysis, report education, and the basic warehouse education, I think are all, and data cleanup. I think those are all things we'll continue with the next few webinars. Yep, people are using that training manual, which is really great. And I hope that the 10 people who don't know what the training manual is knows what the training manual is and they just hit the wrong button. But we can go over that in the new data manager webinar, which is coming up in a few months. Otherwise, there's one published online on the STS YouTube channel, or reach out to me and I'll send you the link, ckrohn, KROHN at sts.org. And I'll send you the link to the new training data manager videos, which will help help you with navigating the website. Okay. Next question, reporting / utilization of data. So for this one, there's 4 questions here. The first one is, do your surgeons review the ACSD quarterly reports? Next one is, has your site ever been audited by STS? Number 3 is, do you perform internal audits on your ACSD data? And number 4 is, have you ever utilized your STS data for internal QI projects? We'll let that run and see if we can. Yeah, we always, okay, so let's see if I can get through some of these questions. That's fine regarding the number of people abstracting cases. We have a large enough group of people answering questions, and the answers that came through, I'm referring to this question from GM 3767. The answer that came through aligned with what we've gotten the last time we've done this survey. So I think the survey is going to be pretty accurate when it comes to showing number of people abstracting. I keep the training manual open all the time, every day. I wouldn't abstract without it. Yeah, I would have it open too all the time. We can certainly add that question, Julia, to the next time we do a survey. STS has that information. I just don't have it available. Okay, I'm going to end this poll here. Hopefully everybody's answered or could answer. So 78% of surgeons of sites on this call say that their surgeons are reviewing their reports quarterly. 71% are saying that they have been audited by STS. 71% are saying that they perform internal audits on their data. And 74% are saying that, yeah, they used STS data for QI projects. So it's all really great news. That's the whole point of the STS databases for quality improvement at the site level, which leads to quality improvement at the national level. Okay. And then I think this is our last one. These are questions related to AQO. And first one is, did you attend AQO in 2022? So yes, in person. This is multiple choice. Yes, in person, yes, virtually, and you watched the Hot Topics webinar, or you did not watch the Hot Topics webinar. For those that joined the Hot Topics webinar, did you find it helpful or solidifying to the knowledge that you learned at AQO? For those who attended AQO, did you feel it was useful? And number 4, how likely, oh, there's 9 questions here. Number 4, how likely are you to attend an in-person meeting in 2024? Does your institution budget for data managers to travel? What challenge do you face with in-person meetings the most? What challenges do you face with in-person meetings the least? And then which location can you travel to the easiest, and which location is the most difficult for you to travel to? And then this will wrap up our database questions, and let that run. And I'm going to go to the next question. She says, our perfusionists fill out the STS forms for the surgeons during the procedure. Nobody signs it that I have seen. Should this still be acceptable for audits? If anything's on that surgeon worksheet that you're abstracting and is not able to be located within the chart anywhere else, then that should be signed because it's part of the medical record at that time. If what's on that surgeon worksheet is discoverable within your EHR within other documents, then you do not need to have anybody sign it. And I hope that answers the question, Danette. We have been notified by our abstractors that all STS worksheets need to be signed by the surgeon. Is this the case, or only if there's information on the worksheet that is not found elsewhere in the patient medical record? That's right. If there's anything on that worksheet that's not found in the medical record, then it should be signed and should be scanned into the chart. Otherwise, anything that's on that surgeon worksheet should be discoverable within the EHR and should align with what's in the EHR. I'll follow up to my previous comment, but you have to scroll back and forth through various sections. Would be extremely helpful if it was all in one spot. We talked about this before, not sure if it can be done. I'll have to, I'm not sure. I apologize if there's so many questions coming in from all different areas. I think you're talking about cleaning up data and having it available, the required fields available in one section. And I think this would be part of something that would be considered like a executive summary, which we're working with IQVIA on. Philip is saying it's not on the list, but I have a very difficult time finding things on the STS website, finding things on the website. Yeah, and it seems like every couple of years we undergo a website design, which tries to make it easier, but then makes it harder because you're used to how it was, and now you're trying to figure out how the new process works. I wish there was an easier way to do the website or what belonged on it. I was on it today, and I think sometimes maybe we need to stick with alphabetizing instead of most common documents. And I don't know, it's something that we can work with our marketing team on to see if there's a better way to organize it. And get your all feedback on that as well. So I'm going to go ahead and stop this poll. I think everybody who's going to respond has responded. We'll share the results. So large number of folks did attend AQO, and about 30% did watch the Hot Topics webinar. For those that watched the Hot Topics webinar, it was helpful. Most of them, it was helpful to them. For those that attended AQO, yep, everybody seemed to have learned something new. And how likely are you to attend an in-person meeting in 2024? Unfortunately, the results here, you can see that they're leaning towards the not likely going to happen side of things. 6% said, yep, they'll be there, bet your petunias on it. 9% said more than likely, but the rest said possible, not likely, or not happening. Most sites are saying that their institution does not budget for data manager travel. The budget affordability is the largest challenge for folks not able to come. The least challenging is the date or length of meeting. split between cities. It looks like Kansas City is not the easiest out of the 5 choices, but other than that, Chicago, Orlando, Nashville, and Denver are split. And then folks said that, oh, that's which ones can you get to the easiest, and then which ones are the most difficult. It looks like Orlando and Denver were the most difficult to travel to. And that's that. And I think that, yep, those are all the questions. So let me continue going through. Oh, I still see some folks have their hand up. So if you want to go ahead and unmute yourself. Let's see, Valerie. Valerie O'Connor Johnson. I just unmuted you. Go ahead and chat if you want. You have to unmute yourself on your end if you wanted to. Okay. Oh, you put your hand down, no problem. Okay, next is PWATT. And then Rosemary Arthur. And Julia Alba. Anybody there? Go ahead and unmute your mics.
Yes.
Hi, Rosemary.
Hi.
You had your hand up. Did you have something to ask?
No, ma'am. I'm sorry. That was earlier when I couldn't submit. I apologize.
Oh, no problem. No problem.
Thank you.
No problem. Okay, anybody else have anything? Go ahead, Julia. And okay, I can't hear you, Julia. Sorry. And P. Watt, anything you have to say? Okay. I'm gonna remove those hands. And let's see. Anything else, Melinda? I'll go through these questions. Do you want to see? Do you have any documentation I can use to encourage my surgeons to fill out the aortic worksheet? I think I would just, I think the biggest thing that they need to remember is that this is their data, and if they want their outcomes to be accurate, they need to help you with it. The aorta section is very difficult. You're going to do the best that you can, but it's very tricky section to try to decipher what they're doing in the OR, especially if they're not the best op notes. So I would just encourage them that, we are going to be coming out with a risk model. These will likely develop into a star rating in the near future. And if they want that to be accurate, then they need to help you with it. I think that's the best I can do. Thanks, Sherry. The Q&A that Melinda and Carol provide is so valuable and appreciated. Yeah, Melinda works really hard on the education, monthly education. Karen is saying we made an epic smart phrase for the perfusion documentation. They use it for all cases, and it has been so great getting rid of the paper documentation. It's really good. Uh-oh. And any chance AQ would be offered online in the future? Attendance was great from what I remembered previously. Yeah, we're still talking about what's going to happen in 2023. More information to come on that. As travel for sites, travel for data managers is really difficult. With budgeting, it's kind of what we expected in these. What the poll showed today is what we expected, and so we have to figure out the best way to get the most information to the most people. Direct data entry needs a validation button to pick up missed questions. I thought there was something in there, Val, but I guess not. Could you send that to me in an email so we can put that in an elaboration call that we have with IQVIA? We have weekly elaboration calls with IQVIA. I'd like to review that with them. AQO, have you consider changing the month it takes place? So we've always done AQO, from what I know, September or October. And I don't know, we usually do that, so it's not right up against the annual meeting. And we used to do it at the end of the year to not overlap with the NCDR with the Quality Summit. But then the Quality Summit changed the month that they were having their meeting, so now we're kind of, we're making sites sometimes choose which one is more important to go to. But it's something, you know, we're always open to change if it's something that's going to work out better for everybody. And maybe that's something we need to ask folks. I'll pass that message along. We've talked about including the AQO fee in the annual fee for the registries. It's a little different. We have different fees and different fee structures for each of our registries. So it's a little bit more challenging when we talk about the other databases. ACSD is pretty straightforward, but the other databases are not as straightforward. So it's a little bit tricky. No budget for training for AQO anymore. Has there been talk about having more web-based training to cut costs? So we have web-based training usually twice a month. This is obviously, you know, one of those times where we're having our data manager survey where we're not doing education, but we have web-based training twice a month, and we are going to talk about the future of AQO in the coming weeks here at STS to see where we're going to land for 2023, either virtual or in person. But STS definitely hears everybody regarding the cost for travel. Okay, the virtual STS yearly meeting AQO was a great option. Please keep offering it both ways. We're still reviewing it. Just a comment, I answered one abstractor because I thought it was specific to dedicated. Okay, thank you, Heather, for clarifying. When the star rating calculation is, you can find that within the National Report Overview in the IQVIA platform under the resource library. If we have a suggestion for the report format that go to the STSDB email address, it would be helpful to display the volumes for the category on the report. So I think it is there, Karen. We're going to go over that in one of these upcoming webinars. I can see the volume per procedure when I look at various if it's either the participant dashboard, I can filter on just cabbage for a specific time frame, and I can see the number of cases. I don't know if it's on each page or not, so it's something we can check out and see if we can provide that. Yeah, IRRs count as internal audits. Oh, I'm glad you used it for your magnet designation, and congratulations, Valerie. That's a big achievement. I agree, Judy. Open the training manual first before you start abstraction. Okay, thank you, Janet, for providing that. Okay. The question regarding, first, is there documentation to take to my OR staff for the need for signatures? We use the DCF and everything is discoverable within the electronic record except the vein collection time. To get them signed might need a document to submit. Can you answer the question again regarding signing interrupt forms, data perfusion, abstracts, and sends to data managers to actually enter in the database? Do they need to be signed by the surgeons? If you're entering anything into your EHR and that's the only source of data or only source of information that provides that answer, then I think it should be signed by somebody before you enter it in to the database, especially if it's going to be used for billing. I would reach out to your medical records department to talk about that. I would reach out to your medical records department to talk about that, just to make sure you're doing it in line with what their expectations are. My questions keep scrolling down, so then I have to keep scrolling back up. I'm sorry, everybody. Yeah, not sure. Yeah, the poll was for 2024. I'm not sure what's going to happen with AQO 2023. Yeah, it is too close to the NCDR meeting, or the NCDR meeting's too close to our meeting, one of the two. But either way, we're going to work on 2023 and see what we can come up with so we don't overlap with the NCDR Quality Summit and any of the other meetings going on at that time. And we're not sure yet if no definitive decision's been made regarding in-person or virtual yet. I don't think we have a report. We just have, so Rebecca's asking if there's a report in IQVIA for patients who were or were not extubated less than 6 hours per surgery. So I think we do have the early extubation, and we can go over that in a different webinar, either this one, not this one, the next one or the following one, when we review the report that comes out for Harvest 1. We'll go through the benchmark data. Yeah, we know at STS that it would be easier for you all to get clearance for hotel fees and travel fees if the registration fee was already included. A location area on the STS aorta form would help. I'm not sure exactly. We'll have to, I guess it sounds like we're gonna have to go over the aorta forms. Danette, could you send this to me in an email so I can check it out further? Because I can't pull up the forms right now and we're running short on time. C. Krohn, KROHN at STS.org. Are they announcing their plans for aortic star ratings at the STS meetings for surgeons? That would help a lot to back up what we are telling surgeons. So they are just about finalized with the aorta risk model. We have a task force call in a few weeks within the next month to review the status of the risk model that's being developed for aorta procedures, just like Dr. Desai presented at the AQO meeting. Nothing has been implemented yet into the reports, but it will be coming soon. And more information will be shared when we have our plan solidified. And we have some of the best aorta surgeons who built the aorta form. So I think perhaps it's just some confusion from the surgeons who are trying to answer it, maybe not understanding what the questions are. So if anybody has questions from their surgeons, could you send them to us so we can help explain it to make sure that we're providing your surgeons with the information they need to give you the answers you're looking for? No, I don't have a date for it. I'm not sure what you mean, Rosemary. Can the perfusion documentation be shared? I can tell you now that the aorta risk model is coming out. It's going to be based as any star rating. It's based on past data. So I think that's the best thing we could do is give our surgeons a head up. And if they don't, hey, this is coming out. It's not going to be based on going forward. It's going to be based on going back on data that was already likely harvested. So I think it's important that you work with your surgeons and tell them that. If it's not a concern from them, then your administration should know when the ratings come out that it wasn't concern for your surgeons at that time. And so you're likely going to have worse results because of the lack of help from your surgeons. That's all right, Desiree, they'd move their meeting. So you should submit for each harvest. The value of submitting for non-star rated harvest is the whole purpose of the database, and that's for benchmarked results, mainly for internal quality improvement. We've never waived fees for regional group leaders. Sandra, so it's not something we're likely to do in the future. Okay, I think I'm gonna have to, we got 2 more minutes. I have we have a staff meeting here at SDS I have to get to at 3. Yeah, I hear you, Sandra, but I don't think that's gonna happen. What is the case amount needed for the rolling 3 years? Yeah, I don't know any of the information. There is a manuscript that is coming out. Did you attend AQO, Catherine or Morama? If not, if you joined virtually, then you heard Dr. Desai's talk presenting all of that information. More information will be coming out. We don't have a version change plan at this time. Please share your smart phrase. This is for Karen and please share your smart phrase. And there is email address to share. We'll have a whole webinar on the aorta risk model when it becomes available. Melissa, your best bet, Melissa's asking about the data download report in IQVIA for the primary data direct entry contact. I don't have any information and I don't know how to do that. I don't have access to a site where I'm located as the primary direct data entry contact. Your best bet, if you could email me, I'll put you in contact with somebody at IQVIA who can walk you through that. Okay. Yeah, so Chris, I have Robert from our research center team, the vice president of our research center, to respond to your question, and we can definitely discuss this on a webinar. I don't know if he responded or not. I know he was getting ready to type the email about an hour or so ago, so I can definitely talk about why a site's risk adjusted rate is higher than the STS and their observed rate. We'll talk about that probably when Chris, if you could remind me when we talk about the Harvest 1 results. Yeah, sites who are at risk for not receiving a star rating for Harvest 1 were contacted 2 weeks before the harvest closed. The slide you show with upcoming dates. So these are all the slides are posted. Oh, where'd it go? All the slides are posted on the STS platform under sts.org. If you ever need to refer to them, let me see if I can find it here. Under sts.org. Registries, the STS National Database. And if you scroll down just a little bit, here are the webinars. View webinars. And then you could see the past webinars here, and the slides will be posted in PDF, and the recording of the webinar will be posted here. So that was registries, STS National Database, and then the webinar section. Thanks everybody for joining. I hope you have a good rest of the day, and we'll talk again soon. Take care, and we'll see you in a few weeks.